So my primary role actually is not in oncology, but more in internal medicine, infectious diseases. But I've been very much involved in health education in the community, have had to counsel and work with many people who suffer from colon cancer, and I just have a passion and interest in it. And so I thought this would be a good opportunity to share some of what's happening in the colon cancer world with you. So I'm just going to go to share my slides here, if you don't mind. And I just wanted to start with this one. So to kind of break the ice and to make it relevant, I think most people know about this and about this Black Panther movie and so on. What's happened? What you may not know, though, is that Chadwick Boseman died at a very young age, 43, from colon cancer. And for a while, this was kept very quiet. And what I hope to encourage you to do is to pay attention to the potential symptoms and to consider the importance of screening. As I go through my slides, I'm going to use the term colorectal cancer. And by colorectal cancer, we're talking about cancer which arises anywhere in the colon all the way through to the rectum. So it's easier to think of it as colorectal cancer and not just colon cancer. And I will use the abbreviation CRC if you see that in some of my slides. Here's some important facts that you may not be aware of, but which are important to know. Colorectal cancer is the second leading cause of cancer-related death in the United States, but it's one of a few curable cancers if caught early. There are not many cancers that we can cure, but if we can catch this one early, it is curable. The American Cancer Society projects that more than 150,000 people will be diagnosed with colorectal cancer this year, and about 1/3 of them will die, or 50,000 people. So early detection is critical because when we find colon cancer at an early stage, the 5-year survival is about 91%. But when it has spread to other parts of the body, the survival is much lower, only about 14%. In general, the risk increases with age. But as I'll show you, the rates of colorectal cancer have been dropping in older adults for several decades, but increasing among young adults. And if you compare two individuals the same age, one born in 1990 and one born in 1949, the person born in 1990 has twice the risk or greater risk of developing colon cancer, 4 times the greater risk of developing colorectal cancer as the person who was born in 1949. Very strange. And the projection is that by 2030, colorectal cancer is expected to be the leading cause of cancer-related deaths among 29 to 48-year-olds. Now, here is a slide, a little busy, just to orient you. We're starting here at 2010 on the left and projecting through 2030. And then we look at different colors. The blue refers to individuals ages 20 to 34. The red, those who are 35 to 49. And the green and purple, older ages. Notice that in the older age group, although overall cancer occurs more in the older age group, the rates are decreasing with time. Whereas for people who are younger, 35 to 49, the red line here, or 20 to 34, you can see the tremendous increase, relatively speaking, in this age group. And this is what concerns us a lot. That this is rising in people under the age of 50. In fact, colorectal cancer is the leading cause of cancer death in men under age 50, and it's the second leading cause of cancer death for women under age 50. Not only colon cancer, but cancer of the stomach, other GI cancers, and cancer of the pancreas are also increasing in younger individuals. Interestingly, as well, if you look at the sex distribution, females in blue, males in green, you can see perhaps similar increases for both men and women in terms of colon and rectum, but for stomach, you can see a greater increase for females and the same thing for pancreas. It's not clear why some cancers are increasing among younger people. And what we also know is that many individuals, by the time that they're diagnosed, they have advanced disease, sometimes with metastasis to other organs. We also know that relapse rates tend to be higher relative to older persons in these younger age groups, despite intense treatment. Several factors have been postulated to explain this, primarily environment, lifestyle, diet, the gut microbiome, and obesity, but none clearly stand out. And this slide shows you many things that have been proposed. And in medicine, we say when there are many things that are proposed, it means that we don't really know what's causing it. And this looks at several cancers. In blue are the early onset colorectal cancer. And you can see here a high BMI, or people who are obese tend to be at risk. BMI also affects early onset gastric cancer and early onset pancreatic cancer. Just for the sake of this presentation, if you look at the blue and you move around the circle, you can see here there's one or two papers that suggest that antibiotic use, which can interfere with the microbiome or the flora of the GI tract, can be important. Sugar-enriched food in childhood, although not clearly associated with early onset colorectal cancer, has been associated with colon adenoma, which can go on to be polyps and progress to cancer over time, as I'll show you. Sedentary lifestyle, again, can be an issue. Low physical activity, high plasma fasting glucose, alcohol use, smoking, the usual culprits. A few more facts about Black individuals with colorectal cancer. It's more common in Black people than most other races and ethnicities. There's a 20% higher chance of getting colon cancer than white individuals if you're Black. And although overall there's about a 30% higher chance of dying from colon cancer, it can be as high as 40% higher dying from colon cancer compared to white individuals. And colon cancer tends to occur earlier among Black people than in other ethnic groups. Again, not clear why. This slide shows you that the incidence of mortality is higher in Black Americans and Native Americans compared to the overall population. Here are the rates for the overall population. Look at the height of the bars, dark blue. This is the incidence rate. This is the mortality rate. If you come up with the American Indians, they have the highest rates, both in terms of incidence, the blue bars, and the mortality rates. So Blacks are just right behind American Indians and Alaska Natives. So the rate is quite high. Now, just to talk about symptoms for a bit. Most early cancers produce no symptoms, and this is why screening is so important. Symptoms, when they occur, depend on the location of the cancer within the colon or rectum. The prognosis tends to be worse for individuals who have symptoms compared to those who have no symptoms. So what are the symptoms? There are several symptoms that can be reported. Anemia because of blood loss over a period of time. Some, when diseases advance, can have weight loss. There's often complaints of the bowel not emptying or feeling empty improperly, but chronic or cramping abdominal pain that's been going on for a while can be a concern in some cases. Rectal bleeding with bright blood or just blood in the stool are sometimes reported, as can be change in bowel habits, persistent diarrhea, constipation, narrowing or what we call pencil-like stools, or just a feeling of weakness and fatigue. These are all symptoms that can be a tip-off, but sometimes there are no symptoms. The most common presenting symptoms that we see, those rectal bleeding. So rectal bleeding is not to be taken lightly, even if it's a little blood in the toilet bowl or in the tissue paper after you're wiping. Many people dismiss this and attribute it to hemorrhoids, but that's a very dangerous assumption to make. And any blood in the stool really warrants a discussion with your physician. Cancers of the colon tend to arise primarily on the left side, although 30% can be right-sided. And these are the ones that are typically more associated with bleeding, but cancers on the right side can cause abdominal pain, and any abdominal pain is a concern if it goes on for a while, particularly if there are other symptoms that you have. Now, there are some things you can control, some you can't. Here are some that you can control. Things that can put you at increased eating a lot of red or processed meats, especially those cooked at high temperatures. Obesity, we talked about, not exercising enough, smoking, heavy alcohol use. Things you cannot control are things like your age. Most people are older than age 50, but as I said, the rate is increasing more in those who are younger than 50. Polyps or inflammatory bowel disease, you may have these, they will put you at increased risk. A family history of colorectal cancer or precancerous polyps also are things that are of concern. And I mentioned race and ethnicity earlier. Interestingly, women with uterine or ovarian cancer before age 50 are also increased risk of colorectal cancer. Polyps can be bad news, not always, but these are growths on the inside of your intestines. Most are harmless, but some can turn into cancer over time if not removed. And this is where screening comes in to allow us to be able to remove these early before they progress to cancer. This just shows the progression from small polyps, stage 0, not invading the bowel wall, to those that are much, much larger. And what we know is that larger polyps increase the risk of colon cancer. And you can see on the slide here, as it increases, what can happen. There's significant risk in delaying screening. And what I want to emphasize here is that the 5-year survival rates can depend on how soon the cancer is detected. For stages 1 through 2B, where the cancer is localized over here, the 5-year survival rate is very high. But as time progresses and the stages increase, then your survival rate decreases. The good news is that there are many options for colon cancer screening. There are a number of stool tests that have been used over the years, and there's some new ones that have come along. And so these are options. Then there are what we call visual tests, where you look at the colon. There's what we call flexible sigmoidoscopy. There's colonoscopy. Then there's virtual colonoscopy, or what we call CT colonography. And very, very recently is a blood test, a so-called liquid biopsy. Looks promising. We don't have a lot of data on it yet, but this is a good test to add to the armamentarium of tests that we have. Colonoscopy is kind of the gold standard, and it's the only one that allows us to remove polyps that they're found. So if you look at this footnote, if a person chooses to be screened with a test other than colonoscopy, any abnormal test results should be followed up with colonoscopy. These are the guidelines from the American Cancer Society. There are several advisory bodies that have slightly different recommendations, but generally the stool-based tests you do annually, except for the DNA test, which is every 3 years. And the colonoscopy, for example, now we say 10 years, but you're assuming here that you have a normal risk. People at increased risk need to be screened a lot sooner and not 10 years. And this is something you must discuss with your physician. But this gives you a rough idea of the frequency of screening. It's not like you can screen once and forget it and think you're fine forever. To emphasize again, 45 is a magic age. This is a time where you really need to consider screening. Now, despite the several options for screening, in fact, screening is very low. And this study that was reported recently, only 1 in 5 eligible patients who should have been screened in age of 45 to 49 actually was screened. Among patients younger than 50 years old, 52% were diagnosed with more advanced cancer versus 40% of patients over age 50. So as I said earlier, those who develop early onset colorectal cancer, when they're seen, a number of them will have advanced disease. But here is the kicker. 3 out of 4 individuals who die of colorectal cancer were not up to date with their screening. And this is really not good news. I won't spend too much time on this, but this just speaks to the barriers to screening. And there are many here, but financial reasons are one. But a big barrier has been the complaints about the prep for colonoscopy. The good news, though, is that because there are several tests, when individuals are offered an additional screening test besides colonoscopy, the acceptance rate almost doubled. So the thing is, for physicians who are seeing people who need to be screened, to offer them not just colonoscopy, but other tests that they may accept. Then if there's something abnormal, to follow up with colonoscopy. The other issue is this one, that doctors sometimes don't recommend screening, particularly in young people. It's easy to dismiss abdominal pain as nothing really serious and blow it off. But you have to take your health in your hand and be your own best health advocate. And that's my suggestion to all of you who are listening. Don't just sit back and wait for doctors to ask for or to recommend screening, because they don't always do it. And there are many reasons for that, but just realize that you need to be your own best health advocate as well. And so here is what I consider to be your colon cancer prevention plan. Learn about your family history of cancer. Start screening at age 45 or earlier. And for those with a family history of colorectal cancer, the recommendation is to start 10 years earlier than your relative's age when diagnosed. Other things you can do is to follow a healthy lifestyle, manage your weight, engage in regular exercise, avoid smoking, eat foods that fight cancer, things like the cruciferous veggies, turmeric, fiber-rich foods, garlic, and so on. And remember, colorectal cancer screening saves lives. Tomorrow can't wait. Thank you.
Right.